Today I'm going to talk about 3 blood tests that are very important in terms of preventing heart attacks and strokes, which are typically not ordered by most doctors. I'm also going to show you a certain hack for how you can fact check not just me, but anybody who is educating and influencing on social media. Kind of an interesting hack. Stay tuned. Quick reminder, heart attacks and strokes, #1 killer in the world by far. Will take more people out of this thing called life early, before their time, than any other chronic disease. And there's a lot of misinformation online about how to prevent heart attacks and strokes, okay? So, those of you that are following my channel, you know I'm a big proponent of getting CIMTs done, carotid intermediate thickness scan. It's an ultrasound of the neck to look for plaque in your neck arteries. No radiation, about $200, $250. Cardiorisk.com is the company I use. They're nationwide, I have no affiliation, but they have great technicians, great technology, and you can actually see the disease. Now, on to today's topic, blood tests. Standard lab tests don't typically include the following 3 blood tests, which I think are really important as baseline. 2 of them you only need to do once because they're essentially genetic. Well, one is genetic and one is influenced by genes. And the third one you could potentially do once or you could repeat. Okay, so let's just get straight into it. Okay, the first blood test that you want to get is an ApoE genotype. That's the name of the blood test. You can get it from any standard lab testing facility, Quest, LabCorp, or any other, ApoE genotype. And when you get that result, you will get told which 2 ApoE SNPs or alleles that you have, because we get 1 from each parent, right? 1 from our mother, 1 from our father. They themselves have 2 SNPs. So which one they pass down is a little bit of a crapshoot. We all have 2, they're called alleles or SNPs. And the options are E2, ApoE2, E3, or E4. And in simple terms, most people, the most common combination is E3, E3. So that's what about 2/3 of the population are, ApoE3, E3, meaning they've got an E3 from mom and an E3 from dad. And an ApoE3, E3 is, like I said, the most common, and it's, in terms of Alzheimer's risk, it's neither beneficial nor, I won't use the word harmful, but it doesn't associate with a higher risk, but it also doesn't associate with a decreased risk. ApoE2, which is more rare, associates with a decreased risk of Alzheimer's. So if you get an ApoE2 SNP, or potentially 2 of them, great, you just won the lottery. If, on the other hand, you get an ApoE4 allele, or SNP, or potentially 2 copies of it, that is an issue in the sense that it associates with a higher risk of cardiovascular disease and Alzheimer's. And I use the word associates with deliberately because ApoE4 is not a deterministic gene. Just because you've got 1 or 2 copies doesn't mean you're going to get Alzheimer's. There's a few very, very rare genes that less than 0.1% of the population have that are deterministic for Alzheimer's. And like something like 10 in 100,000 people have them. So I'm not talking about those. But in terms of these statistics, about 25% of the population have 1 copy of ApoE4. Like me, I am ApoE3-E4. In other words, my mother or father gave me an E3, and the other one gave me an E4. And in terms of which one we get from our parents, like I said, that's a crapshoot, because my sister, for example, same parents, is ApoE3-E3. So that suggests that, let's say it's our mother, let's suppose our mother is E3-E4, she gave me the E4 and gave my sister the E3. Not very fair, but that's life. So like I said, about 25% of the population have 1 copy ApoE4. And about 44% of people who have Alzheimer's have 1 or more copies of E4. So you see the issue here. There is a higher proportion of people who have Alzheimer's that have an ApoE4 allele. Like I said, it's not deterministic, it's associative with. So I think this is a very important blood test to get because it also associates with an increased risk of cardiovascular disease if you have one or more copies of E4. So because it's not deterministic, I think it's very important that everybody know their ApoE genotype status, because if you know, information is power, right? You can potentially do things, lifestyle, diet, exercise, sleep, medications potentially, to try and switch that gene off. So if you're ApoE3, which is what 2/3 of the population are, the most common, it doesn't mean you're not going to get Alzheimer's. You might well get Alzheimer's. And if you're ApoE4, one copy like me, it doesn't mean you're going to get Alzheimer's. You might not. So not a guarantee of anything. We're just looking at statistical associations here. And the issue with having an ApoE4 allele, like I said, twofold. Increased associative risk of Alzheimer's, increased risk of cardiovascular disease. People who have ApoE4 alleles tend to have higher levels of LDL and cholesterol. And point being here, there's a couple of things you need to know about if you are ApoE4. If you go get tested, right? And if you've got one copy of ApoE4 or two copies is very rare. Something like only 2% of the population have two copies of E4, and that's an even higher associative risk of Alzheimer's. It's not particularly good news, but like I said, it's not deterministic. Couple of things you should know, and we're going to get into the hack I'm going to suggest for how to fact check certain people, myself included, right? Studies have shown an association between diets that are high in saturated fat are not good for people who have an ApoE4 allele. It potentially enhances the risk of Alzheimer's that's already there. So for me, knowing that I have an ApoE4 allele, I make sure to limit the amount of saturated fat in my diet. It's not completely eliminated. I mean, I take, for example, olive oil. That has 14%, saturated fat. If you eat those, dark chocolate is high in saturated fat. It's not possible to eliminate it. But I think it's very important, given these studies, if you know your ApoE4, to limit saturated fat and favor unsaturated fats. In other words, polyunsaturated, monounsaturated fats. The other thing that has been shown to be helpful, particularly helpful in ApoE4 carriers, is a diet high in omega-3s. I eat a lot of fish. Salmon, sardines, shellfish like oysters. I have salmon roe. I probably get 4 to 5 grams of omega-3s just through food. I don't supplement omega-3s because it's been shown to be beneficial in people who have an ApoE4 allele. Now, you could argue it's beneficial for the population at large, right? But the point is, if you know you've got an ApoE4 copy, 25% of us do, you might want to consider these dietary issues in order to offset that risk. Now, I'm going to give you the little hack here, okay, for how to fact check anyone talking to you on social media. Sometimes we see these influencers and they post like studies on the screen and it looks all very scientific. I could do that with the points I just said to you, but I think a more fun way to fact check what anyone's telling you is to use an AI app. You could literally pause the video, right? Let's say, I'll show you how to do it right now. You could pause the video, me or anyone else, and then ask AI to go research the entirety of the scientific literature and see if what you're being told through the screen is accurate or not. So let's just do this on me right now, okay? So I've suggested that if you have an ApoE4 allele, or 2 copies, that you try to eat a diet that is lower in saturated fat, because that's going to be more beneficial and offset the risk of Alzheimer's. So you can just pause the video. In fact, I'll show you how to do it right now. Perplexity is my favorite AI app. I just like it better than ChatGPT. I find ChatGPT kind of like almost, I don't know, it's too mainstream for me. I feel like Perplexity is a little bit more independent. So let's just actually ask the question right now. Good morning, Perplexity. I have a question. I'm watching this video channel from Simon the Biohacker, and he has suggested that if a person has an ApoE4 allele, that it would be beneficial to eat a diet lower in saturated fat, and that it would be better to preferentially eat unsaturated fats in order to lessen the risk of Alzheimer's and heart disease. Is Simon making a valid point, or is he talking bollocks? Please limit your answer to something I can verbalize in 60 seconds or less. Let's find out if I'm talking bollocks, okay? Perplexity is thinking right now. All right, I'm going to play it verbally rather than me read it. I'll have the robot speak to you. Okay, here goes.
Simon's core point is directionally valid, but it shouldn't be oversimplified or treated as a magic bullet. What APOE4 changes? APOE4 carriers generally run higher LDL and respond more strongly to saturated fat, with bigger LDL and ApoB increases than non-carriers. Trials and mechanistic work show APOE4s have altered LDL receptor interactions and postprandial lipoprotein handling, especially after saturated fat-rich meals. Brain and Alzheimer's angle, observational data and scoping reviews suggest saturated fat is more strongly linked to cognitive decline in APOE4 carriers, while higher unsaturated fat, especially M3-PUFA, tracks with slower decline in this group. Some cohorts report much higher Alzheimer's risk in APOE4 carriers eating the most saturated fat versus non-carriers eating the least, although this is associative, not proof of causation. Practical takeaway, for someone with APOE4, prioritizing unsaturated fats, olive oil, nuts, fish, and keeping saturated fat on the lower side is a defensible risk management move for both heart and brain, especially if it helps keep LDL-C, ApoB low. He's not talking bollocks, but the message should be APOE4s are more sensitive to saturated fat, so biased toward unsaturated fats within an overall cardiometabolic healthy pattern, rather than saturated fat is uniquely toxic.
There you go. Now, here's the thing. Everything it just said, it cites the scientific sources. So you could click on the links and go straight to the scientific literature. I think this is just a more fun way than someone like me putting up charts behind my head and making it look like I'm this fantastic researcher. You can literally use AI to perform research on the spot when someone says something. So there you have it, okay? Basically confirming, and again, this is all linked to all the literature. So to me, it's just a more fun way that you can fact check what I'm saying or what anybody is saying. Just hit the pause button and say, hey, AI, is this person talking bollocks or not? So there you have it. If you have an ApoE4 allele, it is suggestive that you want to lower in your diet the amount of saturated fat. Why? And this is what I do. This is how I make decisions about dietary intake. Yes, I'm familiar with, the Mediterranean diet, which is kind of what I eat, is generally understood to be healthy. But knowing I have an ApoE4 allele means I go out of my way to try to limit foods high in saturated fat and favor foods high in unsaturated fat. So that's the first blood test. ApoE4 genotype. Information is power, folks. The second blood test, something called Lp(a). The full name for it is lipoprotein in brackets A, and usually it's lowercase. That's why it's called Lp(a). Lipoprotein a. Not to be confused with ApoB, apolipoprotein B. This is lipoprotein A. In simple terms, this blood marker is a particularly nasty, vicious, foul form of LDL particles. I'm going to say this in layman's terms. Think of it as an LDL particle with horns on its head that's got nothing but bad intent for your arteries, right? And it's predominantly genetically determined. So this is why you only really need to do it once. Like the ApoE4 genotype test, you do once. I mean, you're a certain gene type and that's it. Say kind of the same thing with Lp(a). I mean, the blood marker can fluctuate a little bit, but by and large, it's a one-time test. Either you're high in Lp(a), which means you are at extra risk of cardiovascular disease, or you're not high. And if you're high, it's kind of unfortunate in the sense that really diet and lifestyle hasn't been shown to be able to influence it, and there's no pharmaceutical medication that directly targets lowering of Lp(a). There are some in the pipeline in the clinical research process. Hopefully they'll come out soon. There's one drug, the PCSK9 inhibitors, which lower cholesterol, that sort of off-label have been shown to be able to lower Lp(a) a little bit. But there's no clear, definitive FDA-approved drug for lowering Lp(a). Diet and lifestyle doesn't affect it. It's a nasty, 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 vicious kind of a thing, these LDL particles with horns on them. And again, I'm just using layman's simple speak. If you're high in it, you gotta know, okay? You just gotta know. Because if you're high in Lp(a), what you need to do is take every other marker that is influenced by diet, lifestyle, medication, and be extra, conservative in getting all those markers in line to try and offset the additional risk of Lp(a). Like most lipidologists, most serious lipidologists will say to someone that if they've got elevated Lp(a), that they really need to get LDL cholesterol and ApoB to super low levels to try to offset that additional cardiovascular risk from elevated Lp(a). It's just, about 20% of the people of the population have elevated Lp(a) and don't know it, because it's not a standard blood test. So again, I absolutely encourage you to know, because information is power. You get elevated Lp(a), then you can do something with it, right? You can take actions on vis-a-vis other markers to try to offset that risk, just like you can do if you've got an ApoE4 allele. You can take action to intervene so that you don't have to needlessly increase your risk. And the third blood marker I encourage you to get, which is on my earlier videos, I'll put a link in the description and in the pinned comment for this, is a blood test called the cholesterol balance test. It's only available from Boston Heart Diagnostics. You can't get it through LabCorp or Quest or traditional labs. It's a specialty test. What it measures is, in simple terms, proxy markers, sterol markers and that will tell you whether or not you overabsorb or overproduce cholesterol. Again, there's earlier videos on this, I will link to it, but in summary form, it enables you to find out, for example, if you're an overabsorber of cholesterol. I am. And that tends to be the case with ApoE4 carriers. What that means is I can make informed dietary decisions. I know that if I eat eggs, just 2 eggs a day, it'll boil my cholesterol through the roof. I'm an overabsorber of dietary cholesterol. So there's no need to watch all these stupid videos online about, do eggs raise your cholesterol? Do cholesterol-rich foods raise your cholesterol? The answer is, for those of us that are overabsorbers, yes. For those who are not overabsorbers, no. Like, I love eggs. I don't eat them because they just blow my LDL and my ApoB through the roof. So that test will give you that information so you can make informed dietary decisions. The second thing you can do with it, it tracks a marker called desmosterol. And that's a proxy for cholesterol synthesis, right? And if desmosterol goes too low, there's an associative risk, again, I use that word deliberately, with increased risk of Alzheimer's. So you don't want to really be below 1.0 on absolute desmosterol. And statins can cross the blood-brain barrier, suppress cholesterol synthesis too much, and then potentially drive desmosterol too low. So it's a way to check, if you're on a statin, whether or not desmosterol is going too low and you're overdoing cholesterol synthesis in the brain. So it's very important for that reason. And it will help guide medication decisions. So for example, if you're an overabsorber like me, you will get a disproportionately beneficial effect in terms of cholesterol lowering from a drug called ezetimibe. Because ezetimibe, completely different mechanism of action to a statin, helps block cholesterol absorption. So most people who get cholesterol-lowering meds, unfortunately, they go to their doctors and it's like being, they get treated like a robot on a factory line. Here's the statin. Well, it makes much more sense to go in having done a cholesterol balance test so you know in advance of the appointment, are you an overproducer? In which case you would benefit from a statin. Are you an overabsorber? In which case you would benefit from a drug like ezetimibe or cholestyramine, which I take. So again, it gives you information about yourself. So the three in summary are, again, we've got the ApoE genotype blood test, we've got the Lp(a), and we've got the cholesterol balance test from Boston Heart Diagnostics. Again, non-standard. It might be the case that if your doctor is very forward-looking, they'll order the labs for you. Whether or not they get covered by insurance, I don't know. If you do want to get these labs done and you want to use What I do for getting these labs done is I just use my chiropractor. Most people don't know that chiropractors have the legal right to order blood work, okay? And mine does telehealth, so if you want to use him, I don't get paid for saying this, I'll put the link in the pinned comment, the description. You can do telehealth, wellness consults. Chiropractors, they can't treat and diagnose, but they can do wellness consults, and they have the authority to write prescriptions for blood work. So if you want to do telehealth and get these kind of labs through my chiropractor, that's fine. I'll put the link in the description box. Hopefully this was helpful. If you find this kind of practical hands-on information helpful, because that's what I'm trying to do with my channel, then do me a favor, click the subscribe button and drop a comment in the comment section, because it really helps feed the algorithm to get it out to more people. And I will see you next time.